Hello and welcome to another episode of Ask Me Doctor, brought to you by Motherhood.com.my. I'm your host today, 𝗚𝗓𝗧𝗧𝗢𝗏, and we have a pediatric dentist, Dr. Amirul Effendy, to talk about can milk cause tooth decay. So thank you so much for joining our show.
Thank you for having me today on this show.
Yes, so as a toddler or a kid can't live without a bottle of milk a day, that's inarguable, right? So milk is a good source of calcium and fat, which provides energy and aids in growth and development. But I've also heard that some of my mom friends telling me that formula milk is not as healthy as we think, and basically they contain a high amount of sugar. So doctor, the question remains, is milk good or bad for a child's teeth? Can you please shed some light on this topic?
This is certainly a topic that requires more awareness amongst the parents and also young kids. So I'm glad that we are able to touch on this topic today.
Alright. I'm actually very excited to ask you a lot of questions today.
Okay.
So perhaps we can start with the positives. What are the benefits of milk for children's teeth?
Okay, as we know, milks generally have two main ingredients that is related with our teeth.
Yes.
Mainly will be calcium,
Correct.
phosphorus, and some have vitamin D also.
Alright. Alright. Okay, so those are the three ingredients that are very beneficial nutritions for kids, right?
Yes, correct. Because dairy and milks, the ingredients that they have are important for the development and also to maintain the teeth in a healthy state.
Yeah. So I think that's why it's very essential for them to actually consume milk on a regular basis,
Correct.
especially, right?
And when it comes to cow's milk, it is a type of milk that is, we call it bioavailable, meaning it's easily absorbed by our body compared to other types of milk. For example, soil or other types of milk, correct?
Right. So it's the most accepted when it comes to absorbing nutrients,
yes,
right?
correct.
Alright, now that we know that milk is actually very important for kids to consume on a daily basis, my next question is, does milk causes tooth decay?
Okay, a very good question. Unfortunately, yes. Because in milk, we have also lactose, which is a type of sugar. So what many parents misunderstood was, for example, fruit juice, milk, and all this syrup, they have sugars inside. So it's this sugar that is causing decay, or we call cavities. So this problem, it is major in terms of toddlers, of young children, where we call nursing bottle caries, because they will drink the bottle of milk to sleep.
Correct.
So the exposure of the sugar or the milk residues on the tooth surface is being lengthened.
I see.
And that causes the acidic surface or condition in the mouth, which make the outer surface of the tooth, which is the enamel, to be eroded.
I see. So I mean, having a small little baby myself, it's a little bit hard to, considering what you mentioned, nursing
bottle caries.
Bottle caries, yes. How do we actually prevent this from, happening? Because as a parent, it's not easy to actually detach a child from bottle feeding when they want to sleep.
So basically, the main factor according to this nursing bottle caries is the duration of exposure.
Right.
So if you can reduce the exposure of this residue on the surface of the tooth, then should be okay.
Alright, so reduction is better.
Yes.
Okay, any other comment on that?
Actually, there are a few ways that we can use to reduce this tooth decay.
Yes.
Okay. First of all, will be to reduce any intake of food or drinks which have sugars or added sugars.
So it's best to stick with water?
Water or milk with no added sugars.
No added sugar, alright.
Because for example, some formula milk, they have added sugars, so that is not good for our tooth surface. Then the second method is to have the children to drink with a cup as soon as possible.
Alright.
For example, 1 year and above. Because when they drink it with the cup, they swallow it directly, and it reduces the residues on the tooth surface.
Exposure on the enamel and everything.
Correct. And the third method is to rinse their mouth after drinking milk.
Right.
But then it depends on the age of the children.
Yes, definitely.
Some is difficult for them to do that extra step.
Okay, I think this is where some kids are a bit different,
yes,
depending on the child as well.
And of course, the last will be frequent visits to the dentist and also brushing habits.
Regularly,
Yes,
yes.
correct. That will help.
Alright. Alright. That's actually very good tips. Thank you so much for sharing, doctor. But I'm actually curious about what is the difference between tooth decay and cavities.
Okay, basically tooth decay is the process before the tooth have a cavity. So basically how it forms is this sugar that forms around the surface, or the residue that forms around the surface of the tooth, will have the bacteria feed on it because it has sugars. So these sugars let the bacteria feeds on it, and it releases a type of acid on the surface of the tooth, which weakens the outer surface of the tooth, which we call the enamel just now. So once it's weakened, it slowly, after some time, it will become cavity, from a small cavity to bigger one.
I see, so that's how it works. So first you get a tooth decay, following, if you don't take care of it properly, it turns into cavity, correct?
So initially it starts with a small cavity, then when it deepens, it goes into the second or third layer, because our teeth have 3 layers. So when it reaches the second layer, which is the dentine, that is where patients have issues like sensitivity or pain, and when it reaches the third layer, that is where the throbbing pain, they cannot sleep at night. That is how it slowly progresses.
Right, that sounds really scary for a child to experience, actually.
Yeah, definitely.
So what are the signs of tooth decay in children?
Okay, the sign and symptoms of tooth decay actually varies depending on the severity of the tooth and also the tooth structure. So basically, the earliest sign that we can see is actually discoloration.
Alright, discoloration.
Yes, sometimes we see the surface or in between the tooth, there will be white lesions. We call it white lesions, yellow or even brown. The most initial one is white, then it will progress to yellow and brown. Once you see this discoloration, it's a sign that this tooth is actually starts to have towards cavity.
Wow, that's no joke. I mean, as a non-dentist background, I wouldn't know that the white is a bad thing, because I always thought teeth should be white, right?
Yeah, correct. So that is one of the common misconception by parents. They thought white is a good thing, but then actually the white spots, we call it white lesion, is the initial lesion that a tooth can have.
I see. That's why it's important to actually see a dentist, right?
Yes. Then after that, once you see this discoloration, after some time it will then progress to the cavities. And these cavities normally appears on the pits and fissures, we call it, meaning those gaps area or those line area on the tooth surface. So those are the initial areas that will have the tooth cavities, because those are also the areas that all the food gets stuck.
I see.
Correct.
Alright.
Then if, let's say, this thing progress, as we mentioned just now, it will lead to tooth sensitivity, because it involves the second layer of the tooth, which is the dentine. And if it's progressed some more, it will lead to conditions like bad breath, tooth, swelling, gum swelling, and also possibly, if it gets worse, it can lead to tooth loss.
Oh my god. I mean, it sounds so scary for a child to actually experience all this at a young age. So I guess it's really important for parents to take care and be aware of what they're consuming at this age, right?
Correct.
So we know young children actually need to drink milk daily, right?
Yes.
Yet it can be one of the main contributors to tooth decay, which leads to my next question. What is the best milk for a child's teeth then?
So many parents having this dilemma between giving a child milk, which they know is healthy for their teeth, but also to know that the fact milk is also one of the contributing factor for the decay. So there was this research done a few years ago where they found out that cow's milk is one of the least carriogenic type of fluid or drinks that a children can get. Carriogenic meaning how fast a tooth can develop caries. So they found out that the cow's milk has the least, meaning it takes the slowest to develop, if there is. And they also, of course, on the other side, they know that cow's milks have all the main ingredients. For example, the calcium, the phosphate, the vitamin D, if there is, which is the main ingredient that our body needs to strengthen our tooth surface.
I see. I actually didn't know that there's such a difference between cow's milk and other type of milk, because I thought milk was just milk.
Because sometimes, like for example, formula milk, some of the formula milks, they have added sugars. So that leads to the initial problem, how cavities are formed for children when they drink for a long extended period.
I see. Okay, so I guess that's where educating a child to educating them with early dental hygiene is important.
Correct.
Yep.
Because if the sugar that is added in the milk and it resides on the surface of the tooth just now, like we mentioned, that leads to the erosion of the surface of the tooth.
Yikes, sounds so scary.
Yes.
I should worry about my son's dental care right now. I feel like bringing him to dentist just to be sure I'm doing something right.
True.
Okay. Wow, that's actually a lot of information to absorb. So I actually really appreciate all those information shared with us today. So before we end our conversation, would you have anything else to add on?
I would want to say that I would like to emphasize parents to choose wisely the liquid or food that they choose, especially milks or liquids with hidden sugars, because sometimes they might just label it differently in terms of the sugar, but then it is still a type of sugar which can lead to these teeth problems. So they have to really choose the milk or any liquid that their children consume wisely.
Correct. So moms, make sure that you educate yourself about the type of different names of sugar, because this is where it's our job to make sure that our child is consuming the right kind of nutrients and not consuming too much of hidden sugars, right, doctor?
Yes, correct.
Alright, so once again, thank you so much, doctor, for this very enlightening conversation. So to the mommies out there, even though your child's baby teeth are temporary, they're important and are still prone to cavities. Children need strong, healthy teeth to chew their food, speak, and have a good-looking smile. This episode has been brought to you by Motherhood.com.my, and special thanks to Farm Fresh for sponsoring this episode of Ask Me Doctor. Farm Fresh Grow is packed with high protein, DHA, and a natural source of calcium, vitamin D, and is fortified with 22 essential vitamin and minerals. This growing up milk is specially designed for children 1 to 6 years old and has no added or hidden sugars, is free of maltodextrin, vegetable oil, and calcium carbonate. Only goodness and nothing else. So once again, thank you so much for watching. I'll see you again next time. I'm 𝗚𝗓𝗧𝗧𝗢𝗥.
I'm Dr. Amirul Effendy.
And this is Motherhood.com.my. Bye! Hey, wait up! Don't forget to join our contest and stand a chance to win incredible prizes from Farm Fresh Grow. All you need to do is just follow these simple steps. Step 1, answer this simple question. Name one method that can be taken to reduce tooth decay. Step 2, tag 3 of your friends and share this post. Oh, and remember to have your account set to public so we can take a look at your amazing submissions. Wishing you best of luck. Bye!